put on our commerce hat and pretend this was an insurance company, I cannot imagine members of the committee sitting quietly saying, oh, well, they just messed up and it'll get fixed and we'll give them 2 years. But when it comes to the entities we're responsible for, like, okay. And then they're going to come and ask for more money because they missed their MinnesotaCare premiums and they don't know how to get them back and it's not fair to consumers and all of that. And we're just kind of floating along. There will be more money because they'll say, oh, we can't serve people. And then they'll go to the press and say, we don't have enough staff to meet these needs, and so there will be more money. It shouldn't take 2 years. MMIS has been standing up for a really long time. You're moving from Curum back or to functionality, however you'd like to phrase it. And you're telling me you have auditors and you do internal audits and you're checking eligibility. You can't be doing that and have stories like this be true. So I guess I don't even need to hear you've got a 2-year plan because we've had a 3-year plan and we've had internal auditors. And so really, when is somebody going to get fired or somebody going to be held accountable? When are the taxpayers going to get the value that they put into all of these systems? When is somebody going to have mercy on the consumer who gets the letter in the mail that says you're no longer eligible, but the date of the postmark on the envelope is after their 10-day termination? I would really like to know when somebody's going to get sick to their stomach about that and shake something up and make it happen in less than 2 years and not for $10 million.
We got some systems issues. You guys have outlined those. You guys have outlined the numbers. When we looked at some of the OLA report before, there was a lot of trying to interpret that data in a snapshot at times that we weren't doing really well. Like, and Senator Benson talked about it, either you're eligible for one program, so you're eligible for MA, but you got MinnesotaCare, then there was a lot of talk about where you were actually eligible to be in the QHP or MinnesotaCare, but you got MA, and then what was the cost to the state? I can remember, Senator Lori, there was all of this kind of talk about that and what the net outcome was for the state in terms of costs, what it was for the plans, what it was for the consumers. I guess what I'm just trying to get at is that is the stuff that we hear, and often what we often hear, no matter what it is kind of the worst case scenario, or what someone finally gets fed up and writes the paper about. What I'm trying to understand is how much of that is an everyday occurrence that you're trying to fix versus how much of that is just really kind of a few folks that really have just kind of that are outliers in terms of what the problem is. So, Ms. Morocco, we've talked before about, you just talked about a switch didn't happen, and so you just took that subset of folks, extended them out, and then you're filling in the backlog, and then you fixed it. But how much of it is all of this what's the word I'm trying to find, where we miscategorize people in terms of their eligibility? What's your sense, Mr. Morocco, of how much of that is happening? And you may not have an answer, but that's what I think we all want to know.
What I would say is that we're more confident today in the eligibility than what we would have seen even 6 months ago. And I say that because even in June of 2015, we were still doing renewals that were January renewals. So, and I certainly appreciate, Senator Benson, your frustration. I think the commissioner presented her frustration, and I'm frustrated as well. So, what we look to is a system that can help us do the things that we need to do. As far as eligibility goes, it's relatively good at this point. I mean, if we know that the eligibility rules themselves are working well. When somebody comes in, puts in their household income and the household composition, it is able to sort out whether they're MA, MinnesotaCare, or QHP. Do we have a percent or not? That's to be determined as we audit sort of this point in time. I think what confounds the administration at this point, the administration of the programs, is just as you described, Senator, and as others have mentioned here, it is in the notices. The fact that there's a MNsure logo on a MA letter on, for an MA program. That's confusing. When somebody has an appeal question and it's the MinnesotaCare phone number, or I'm sorry, it's the MNsure phone number, when somebody has an appeal question, that's confusing. So we know that premiums are not going out accurately and timely. That's not only confusing, but that's not good for program integrity. So what we know is that when folks come into the system, that part works generally well. What we want to fix is, as we've described here today, is the premium process, which is moving back to MMIS. And so we're hopeful then, starting in February, that those will be accurate and timely. And then what is slated for the roadmap for 2016 for fixing these problems. I didn't see the handout that came out, but it may or should have notification listed on there as one of the projects, or certainly it is on our project roadmap for 2016. And notifications are going to be something that's going to be on our radar for the entirety of 2016. The unfortunate reality is that we have a lot of touch points with our clients. There are a lot of notifications that need to be adjusted and made to work better, and that will be part of our Mets roadmap for 2016. So, to Senator Hayden, my apologies for the long answer, but I can't give you a percentage, but I can say that folks that are coming on, we do feel confident that part is working well, and that it is doing accurate determinations. But we know that we have a long way to go in terms of what happens after that, really managing the case, communicating to the clients. That's the part that really needs to be significantly improved.
Mr. Chairman.
So